Hello friends, so our today's topic is temporomandibular joint, that is TMJ. We have three major joint: fibrous joint, cartilaginous joint and synovial joint. So the TMJ is a synovial joint of condylar variety. As you can see in this picture, it is a joint which is in front of the ear at preauricular surface. So we have three major articular surface: articular tubercle, anterior part of the mandibular fossa and the inferior surface of the head of the mandible. As you can see in this picture, TMJ is made up of temporal bone and the part of the mandibular fossa and the head of the condyle. So the joint cavity divides into upper and the lower compartment. Coming to the various ligaments of the TMJ, there are basically four major ligaments: fibrous capsule, lateral ligament, sphenomandibular ligament and stylomandibular ligament. It attaches above to the anterior tubercular, circumferentially of the mandible in front, squamotympanic fissure in behind and below the neck of the mandible. Then second ligament is lateral ligament or the temporomandibular ligament. It gives strength to the TMJ. It attaches above the articular tubercle and below to the posterior lateral aspect of the neck of the mandible, as you can see in this picture. Third is the sphenomandibular ligament. It is an accessory ligament which attaches superiorly to the spine of sphenoid and inferiorly to the lingula of the mandibular foramen. Then comes the stylomandibular ligament. It is also an accessory ligament. It attaches above to the lateral surface of the styloid process and below to the angle of the mandible, adjacent to the posterior part of the ramus. Then coming to the articular disc, which is a fibrous plate and oval in shape. It divides the joint into upper compartment and the lower compartment. The upper compartment has a gliding motion, whereas the lower compartment has gliding plus rotary movement. It has a superior concavo-convex surface and inferior concave surface. It has different part: anterior extension, anterior thick band, this is intermediate zone, then the posterior thick band and the bilaminar region, and there are plexus behind the bilaminar region. The disc prevent the friction between the articulating surface. Coming to the relation of the TMJ, literally the TMJ is related to skin and fascia, parotid gland and the temporal branch of the facial nerve. Medially, as you can see in this picture, it is related to the spine of sphenoid, which is present medially, then auriculotemporal nerve, upper temporal nerves and the middle meningeal artery. Anteriorly, it is related to the lateral pterygoid muscle, mesenteric nerve and artery, and then posteriorly to the superficial temporal vessels, auriculotemporal nerve, superiorly to the middle cranial fossa and middle meningeal veins and artery, and inferiorly to the maxillary artery and veins. Coming to the blood supply of the TMJ, blood supply is with superficial temporal vessels and maxillary artery. Then coming to the nerve supply is with auriculotemporal nerve and the mesenteric nerve. Then coming to the different movements of TMJ. TMJ helps in the depression of the mandible, elevation of the mandible, protrusion of the mandible, retrusion of the mandible and the lateral movements. These all are the movements of the TMJ and different ligaments are responsible for this. We have the different TMJ clinical implication like ankylosis and TMJ dislocation. We will made a separate seminar on the clinical implication of TMJ.